UC Davis Health presents with Project Adam Sacramento. Learn how to save a life, hands-only CPR and AED training.
Hi, I'm Heather Siefkes, and I'm a pediatric ICU physician and the medical director for Project Adam Sacramento. On January 22nd, 1999, Adam Lamel was a healthy and active 17-year-old. Among many of the things that Adam enjoyed, he loved playing basketball. And on that day, he was playing basketball at school when he collapsed and died from an undiagnosed heart condition. Adam's death is a reminder to us of the thousands of people who die every year from sudden cardiac arrest. In his memory, Adam's parents, Patty and Joe Lamel, partnered with Children's Hospital of Wisconsin to create Project Adam. Project Adam's mission is to save lives through prevention of sudden cardiac death, through implementation and education of CPR and AED programs. Since its inception, Project Adam has collaborated with numerous hospital systems to create affiliate programs throughout the country. In 2015, UC Davis Children's Hospital partnered with Project Adam to create Project Adam Sacramento, the first in California. Whether your children are learning at home or in the school, we are your partners in preventing sudden cardiac death and saving lives.
Darren's story of survival.
At 10:32 on September 13th, I died. I hit the floor, no heartbeat, no pulse, no respirations, I was gone. I suffered sudden cardiac arrest. September 13th, 2019, went to work just like any other day. Had no idea that everything was going to change. Friday the 13th, I was working in the maximum dorm I'm a correctional officer for Sutter County Jail. And a call went out. Officer needs assistance. All available officers, please respond. So I immediately started hustling over to minimum, and it's actually in another building across a small parking lot. I was the furthest away of everybody that responded, so had the furthest to run. I was right behind another officer when I went through the two doors. When he got to the second door, he swung it wide so that I could catch it as I came up. I grabbed that door, and I could remember thinking, I think I need to sit down. And everything went black. I work at a jail where there's cameras everywhere, so everything I can tell you from this point on is because I've reviewed the video and, of course, talked to the people that were there. At 10:32 on September 13th, I died. I hit the floor, no heartbeat, no pulse, no respirations, I was gone. Within 15 seconds, a fellow officer was on me, called for help. Within 45 seconds, I was receiving air compressions. I dropped right below an ambu bag, and I was 4 feet from an AED. I work with the greatest officers a man could even hope to work with. These guys never missed a beat, knew exactly what they were doing, defaulted back to their training. At 3 minutes and 40 seconds, I received one shock, which brought me back to life. I can tell you that every medical professional that I've talked to, my doctors, my cardiologists, have assured me that if it wasn't for those officers, I wouldn't be here today. There isn't enough CPR in the world that would have brought me back. That AED was the only thing that would have worked. I suffered sudden cardiac arrest, and the difference between that and a heart attack is, a heart attack, you can ask for help. You know something's happening, hey, I need some help. Sudden cardiac arrest, usually the first symptom is death. So many things happened correct that day. I was the last one there, which meant everybody was already there, so they didn't need to call for any more help. I dropped right below the ambu bag. I was 4 feet from the AED. The most important thing that happened was I was with 5 individuals who were trained. They knew what to do. They knew how to do CPR. They knew how to use an AED, and thank God an AED was available. And if it wasn't for those, I'd be dead. My wife would be a widow right now. So I can't emphasize enough how important it is that AEDs are available, that people are taught how to do CPR and taught how to use AEDs. Because every day that I have with my grandkids, I owe to those people. I owe to the fact that they knew what they were doing. I have the video on my phone, so anybody that doesn't understand the importance of an AED gets to see my video. I can remember learning CPR when I was a child. And it's one of those things that kind of sticks with you. You know, even if you don't ever have to use it, you're going to remember the basics. And it's important that Project Adam gets that message out, that these kids are ready and they're prepared to do what they have to do. I mean, this can happen to anybody. It can happen to one of them, it can happen to their parents. Project Adam is doing some good work. It's getting the message out there, it's getting the training out there. And I want to do anything I can to help them. It's human nature to think that we're bulletproof and that it'll never happen to us. There are so many children that this happens to, especially in sports at high school. This happens all the time. 9 times out of 10, it's going to happen out in the fields where there is no AED available. That's where CPR becomes so important. And the last thing that anybody would want to do is know that if they would have just learned CPR, they could have done something. And that's probably the most important message that we can get out there is learn it, be prepared, because one day you'll be glad you did.
Heart anatomy and physiology.
Hi there, I'm Dr. Yoni Dayan. I'm a pediatric cardiologist at UC Davis Children's Hospital. I wanted to talk to you about the heart anatomy and physiology today. So the heart is a muscle in your chest that beats and pumps blood and oxygen all around your body. So the heart, if you imagine it like a box or a house, sort of has 4 chambers or 4 rooms in it. The upper chambers are called atria, and the lower chambers are called ventricles. The atria collect blood from the body and the lungs, and the ventricles pump blood out to the body and the lungs. So blood with oxygen comes from the lungs into the left atria and gets pumped down to the left ventricle, which pumps the blood out to the body. The body uses that oxygen, and then the blood without oxygen comes back to the right atrium, to the right ventricle, and then gets pumped back out to the lungs to collect oxygen. That happens with every heartbeat, and it happens all day long and keeps on going to give blood flow and oxygen flow all around your body. And the way that the heart knows how to pump that blood is an electrical conduction system that goes through your heart and sort of tells the upper chambers to beat and then tells the lower chambers to beat.
Signs and symptoms of sudden cardiac arrest.
Sudden cardiac arrest or sudden cardiac death is a life-threatening disease that happens because of a problem in the electrical conduction system of the heart. It can happen to seemingly healthy people of all ages, all over the country, all over the world. Sudden cardiac death happens up to 350,000 times a year outside of the hospital. It's hard to look for signs before this happens because sometimes it can happen without any preceding signs or symptoms. What you look for is somebody who loses consciousness all of a sudden, faints, is unable to be woken up. Sometimes they have irregular breathing or gurgling sounds while they're breathing, shaking or convulsing movements, and sometimes they have chest pain just beforehand. Sudden cardiac arrest differs from a heart attack because a heart attack is actually a problem with the plumbing system of the heart. There's not enough blood and oxygen going to certain parts of the heart, so those parts don't beat as well. In sudden cardiac arrest, that's more of an electrical problem of the heart. The heart's beating irregularly and far too fast, making the pump of the heart not work correctly and not enough blood and oxygen coming out. Sudden cardiac arrest is a fatal disease, but survival can be improved if you act fast, and act now. CPR and AED implementation very quickly can save a life. After 5 minutes, the chance of survival in a sudden cardiac arrest patient goes down by 10% every minute. So if you do the math, after 15 minutes, a sudden cardiac arrest patient has a 0 chance of survival. Act now.
The cardiac chain of survival. Recognize sudden cardiac arrest. Call 911. Start chest compressions. Apply an AED as soon as possible.
How you doing, everybody? My name is Carter Todd, and I'm a bedside registered nurse at UC Davis Medical Center in the pediatric ICU. I'm here today to talk to you about sudden cardiac arrest. The first sign and symptom of sudden cardiac arrest is often death. This happens because no one realizes that there is a dangerous underlying rhythm that's taking place, or no one's there to help. 95% of people die from sudden cardiac arrest because no one intervenes quickly. If you're there, you should call 911 and start with CPR. CPR is when you're circulating the blood flow for somebody so that it gets to their body and their brain. This can be a bridge to the next step, which is an AED device. An AED device provides an electrical defibrillating shock to the heart to put it back into a healthy rhythm. So now we're going to perform the survival chain. We have 2 volunteers who are going to be performing CPR and the proper use of an AED. So volunteer number 1 finds an unresponsive person, either at home or in the community, immediately sends someone else to call 911 and find an available AED. After checking to see if there's any breathing, she immediately begins CPR. Her CPR is fast and hard at least 100 beats per minute, at a depth of at least 2 to 2.5 inches for adults and 2 inches for children. Upon arrival of an AED, immediately turn it on and apply the pads to an open, bare chest. AEDs can be found in schools, gyms, airports, and many public places. While applying the pads, the machine will then give you step-by-step instructions of how to perform CPR and AED resuscitation. When the machine prompts you, it will analyze for a heart rhythm. If a shock is to be given, make sure that the scene is safe and clear, and then give a shock. And immediately perform CPR. After about 2 minutes of CPR, volunteers will need to switch so that they do not get too tired. The AED will again prompt the people performing CPR to analyze an underlying heart rhythm. Shock is not given, so CPR is resumed.
How to perform CPR and use an AED.
Unit OK. If patient is a child, press child button. Don't touch patient. Analyzing. Don't touch patient. Analyzing. Shock advised. Don't touch patient. Press flashing shock button. Shock delivered. Start CPR. Push to match the tone. Stop CPR. Don't touch patient. Analyzing. Don't touch patient. Analyzing. Shock advised. Don't touch patient. Shock delivered. Start CPR. Push to match the tone.
How your school or business can be more prepared for a cardiac emergency.
Thank you for watching. And now, for more information on how your school or business can become more prepared for a cardiac emergency, including how to become a heart-safe site, please search Project Adam at health.ucdavis.edu. Thank you.